Thank you for joining the Healing Us podcast today. I'm welcomed by Peg Wright, the founder of Great Expectations in North Jersey. Thank you so much, Peg, for joining us. We're so happy to have you.
My pleasure. I'm happy to be here.
Fantastic. So I want the audience to know all the amazing things that you've built. Great Expectations started in 1998, right?
Yeah,
Yeah, so it's been a lifelong project for you. So tell us about the programs and what you do at Great Expectations.
sure. Well, we started out in Somerville in a little house with 2 bedrooms and 4 beds in one, two in the other, and one bathroom for 6 pregnant women. So you can imagine it was a little crazy. I
Yeah.
mean, the most challenging part was that women couldn't come back after they delivered their children.
Mm.
And so we knew that we had to do something different. And, at that point, I was new in a nonprofit setting. I came from a corporate setting. So I really didn't know much about, boards or any of that. So I was learning all of that. And at the same time, we decided, we need to raise some money and build 2 buildings that are dedicated to pregnant and parenting women so that they could come back after they delivered their children. So we did that. And then, we started out in 98. So I guess it was around 2003 that we bought 3 acres of property in Somerset from St. Peter's Property Corp. And, we just started the process, just it was a megillah, it was a $5 million project. And we built two 16,000 square foot buildings, one dedicated to adolescents and pregnant or parenting, and the other dedicated to pregnant and parenting women with substance use and mental health disorders. So that's how, and it took a while. We started construction in 2005, and we didn't open until the end of 2008.
Wow.
Wow. It was
That's
quite
that
a
required
challenge.
a lot of patience on your end, I'm sure.
A lot of patience, a lot of learning,
Yeah. Yeah.
I know a lot about, suppression systems and
Well, I think too with that demographic in particular, I'm sure there's just a lot of specific needs from a clinical and care perspective that probably weren't
yeah.
even anticipated prior to construction.
Well, you're right. I mean, in the beginning, we were pretty much, your garden variety 12-step program for
Hmm.
pregnant women. And, when we moved in, we were still kind of that.
Yeah.
We also had a child development center on site. So that was an important component.
Mm.
But I think the main thing is that we evolved our model of care, the way that we treat women over time.
Super
And, that
important.
was like a pretty much a constant change process.
Yeah. Yeah. I'm sure it's still evolving every year with different modalities and
It
discoveries.
is.
Yeah.
Yeah.
So what made you start with that first house in Somerville? What inspired the project?
Well, I was, believe it or not, I was selling CAT scanners and diagnostic imaging equipment, and I
Wow.
got pregnant with my son, who is 37, and stayed home and stopped working because I was traveling all over the place. And I started volunteering there.
Mm.
He was in school by then. He was like 3 in preschool. And I was kind of bored. And I decided, maybe I can help. And so I met these folks, and it appeared to me, pretty quickly that we could do things a little bit differently. And I met a sister of St. Joseph, Rita Wolke, and she said, Peg, we should really be serving homeless women, and we should focus on women with substance use disorders. So I thought that was a great idea. I'm a person in long-term recovery myself,
Congratulations.
and that was 36 years.
Wow.
Yay. But in any case, I really listened to her, and she wrote this incredible mission statement that spoke of a safe place, a safe presence, and a safe path. And those elements are trauma informed. And what's fascinating about that, I mean, they hadn't even invented that word back then. I mean, no one was talking about that. And she knew all about that. And so, that's where we started. And, when we finally got over to Somerset in 2008, 2009, uh, shortly after, Dr. Debbie Roussard joined me. And she came in and she said, Peg, you should really consider, treating women in a trauma-informed approach. And when she described to me what that was, I thought she was crazy at the time. I mean, it scared me. We're going to give women choice and, all of the elements of what makes a trauma-informed environment. I didn't get it. So my clinical supervisor at the time, Dr. Lauren Vocaturo, said, Peg, just, shut up and listen. And that's what I did. I'm good at taking direction. So I did that. And I guess within a year or even less than that, I began to see why that was so critical and how that really, infuse the entire environment, not just a model of care, not just the way that you delivered care, but really everything. The way you answer the phone, what does the environment look like? And we knew right out of the box when we were planning that we wanted to really speak to the dignity of the women we were serving. So the space is lovely.
Yeah, I've heard.
Everyone has their own bedroom. Everyone has their own bathroom. And they need that in order. They have to have a place to go to, work through all of the hard work that they're doing during the day.
Yeah.
So,
and, it's, first of all, it's such a distinct demographic, and I know you treat men as well, and we'll get into all those other programs. But pregnant women in particular, there's not a lot of resources.
Right.
I don't even know of really any other facilities where you can also continue care postpartum, which is just as crucial. So it's amazing what you've built and the privacy and dignity and space that you've given these women to heal and recover. Yeah. It's wonderful.
Yeah. And it's a change process, right? You learn as you go along, so, Dr. Roussard introduced the concept of, working with women utilizing a trauma-informed lens. But as we progressed and moved along, we introduced, we enhanced, if you will, the model of care. So we were, at one point, I don't remember the exact date, but we were funded by the NCTSN, which is the National Child Traumatic Stress Network. And so we introduced what is called the ARC model, which is another way of delivering a trauma-informed care. And, we were funded by the NCTSN, I guess, for two 5-year cycles. And around that time, then we also infused an early relational health approach, which is, people talk about infant mental health. They don't know what, we're talking about, but essentially it's treating the relationship between the mother and the infant. So the client is not the mother, it's not the infant, but it's the relationship between the two of them. And that is also infused, within the model that we are developing. And our director of that particular approach studied with Dr. Ed Tronick at University of Massachusetts, who's sort of the father of infant mental health. Because, you got to think, Ashley, when you think about it, trauma is generational, it just is. And, if you were raised in an environment where, you were treated, if substance use was present, for example, or, neglect and abuse happened, then, all of the things that we think about as trauma, and in essence, complex trauma is sort of like water dripping,
Right.
it's a constant.
Yeah.
It's not an event. It happens over time. And so in that environment, you end up in a fight or flight mode. You're not really able to regulate your emotions. And you're not able to parent in a way that is loving and caring because you didn't receive it yourself.
Right. Or there's just too
So
much going on. You don't even get the opportunity to do that.
exactly,
Yeah.
exactly. All
Wow.
of the above.
So
So
how
Yeah.
long can
how long
women
can
stay
women
with
stay
you
with you
guys? What's
guys?
the
What's the
average
average
duration?
duration?
Well, the length of stay in the adult program is 6 to 9 months,
Okay.
but it's really driven by the discharge.
Mm.
So, the treatment plans are reviewed in an ongoing way over time, and the discharge is key. Like, so where are they going? We're fortunate in that, we recognized, as we grew that treatment can't stop, care can't stop in a residential setting. It only starts there.
Mhm.
So, we were fortunate to, pretty early on, I guess it was 2010, we received a SAMHSA grant and opened an outpatient program. So that still exists to this day. In fact, we're going to be talking to your brother about how that might work. But
Awesome. And
uh,
that's just out like outpatient one-on-one therapy. Is it PHP-IOP or just
it's not a PHP. It's not
okay.
it's an intensive outpatient.
Okay.
Okay.
We have a separate mental health license, so we can treat folks presenting with mental health without SUD.
Okay.
So we knew that was important, but we also knew that supportive housing was important.
Mm-hmm.
So we have 16 supportive housing apartments behind the residential program. And then we have another 10 scattered, some in Middlesex, some in, they're kind of all over the place.
Mm-hmm.
So 27 in total, and which is not enough,
Yeah.
by a long shot. So
No.
I have a couple of trustees that, with Murphy's recent requirement to expand, affordable housing, it's rather significant.
Mm-hmm.
Mhm.
So, for example, just in Franklin Township, they have to increase by 900 units.
Wow.
Wow.
And yeah,
Where are they gonna
which is
go?
crazy.
Where are they gonna put them?
Yeah, good question. I
Yeah.
know, right? Nobody knows that. I mean, it's the government,
Yeah.
but anyway, but that's good for us
Yes.
because we are considered a special needs population.
Mm.
So if we partner with a developer, we fulfill like a 2-to-1 ratio. So they'll get credit for 2 units by partnering with us.
Okay.
Okay.
So we're going to be able to increase our supportive housing offerings, probably reasonably significantly. So we're excited about that.
That's amazing.
So that's one part of the continuum. And then, so for example, a woman but she's got to get the approval from the state, and that's a whole other Megillah. That can take.
Forever.
We won't discharge until that individual's in a safe place.
That's beautiful.
So if that can happen in our supportive housing environment, that's great. If that woman needs continued care, which often she does, she can access care in our outpatient, or she can also receive care from our in-home program. So we have a program called START, which is essentially a doula case manager, a peer support specialist, and a clinician. So we're present in 9 counties right now and expanding that. So that team can actually visit that woman in her apartment and continue to provide supportive services to her. So that's an important component. And if she's, depending upon where she lives, she can continue to access the Child Development Center for childcare.
Mm.
So it's a circle,
Yeah.
and that kind of support has to happen if you really want to,
It's that
That
long term.
achieve,
Yeah.
sustained recovery. Yeah.
What would your dream be to see in the maternal mental health space overall, outside of Great Expectations?
Well, it's, we're in quite a mess. It's rather extraordinary that in this country we are still, struggling with maternal well-being. It's crazy.
Yeah.
Yeah.
I think, to a large extent, Ashley, a lot of problems regarding maternal health, especially with women with substance use, stem from stigma.
Mhm.
So, I mean, we work pretty closely with the Commissioner of the Department of Health, Christian Baston, and Dr. Baston is brilliant. Came from Camden, and I remember recently, probably maybe 6 months ago, Somebody from NJ Spotlight uh, got in touch with her and said, I want to talk to you about maternal mortality. And she said, well, you know that 58% of women who succumb to maternal mortality do so because of a substance use and mental health disorder. Wow. And this woman was with NJ Spotlight for 9 years. And she said, you got to be kidding me. No one told me that. I've been covering this for 2 years. Mm-hmm. So she said that I'm talking to you about the problem. Now go talk to Great Expectations about the solution. Mm-hmm. And part of the solution, quite honestly, is education. Mm-hmm. And training and consultation. Mm-hmm. And because of the experience that we've had over these last 26 years, we've created what is called the Institute, which actually trains and consults in healthcare environments to assist those in OB and L&D and other areas about what they're seeing when a woman presents with SUD. Mm-hmm. She's not a bad person. Mm-hmm. She's got an issue that is preventing her from living a life well lived, and we can help with them in understanding exactly what that is.
I also think that intervention, like the ripple effect, because you're immediately changing the experience of a child and hopefully impacting their
right.
Right. Exposure.
Yeah. So within the next, I don't know, we're literally in the throes of a contract with some of the, and we've done it already in training and consultation at Robert Wood Johnson, at Meridian Hackensack, and just doing training and consultation around pregnancy and SUD, around medication-assisted treatment, and just how we can help. So, what we'll be doing, for example, at RWJ is we're piloting a program where, if a woman presents in OB and has a substance use disorder, that physician can actually reach out to our START team in that community, and they can take that patient on and assist through her pregnancy and post-pregnancy. So, yeah,
that's
it's a big deal.
Cool. Yeah. What are, through your work, what are some lessons that you feel like you've learned over the years?
What are some
lessons that you feel like you've learned over the years?
Oh boy.
It's a broad question.
That's a big one. Don't waste any time. Fail fast. And I guess, because, we're in the process of completing an actual model. It's called the relational recovery model. And we've been working with Rutgers. We collect a lot of data. We've been working with Dr. Emily Bosk and Dr. Denise Hean. And it's all about the relationship, 100%, and so how I relate to you, how I relate to my team, the community at large is really, I think, the most important, the heart of everything that we do. So if you can do that in a way that is, we talk about servant leadership, but we really want to help.
Yeah.
That's why we're here. We want to help. We want to make things better, and we want people to understand. And so I think over time, within, the realm of my own recovery and within the realm of working with, I have a brilliant team. Brilliant. They know a lot more than I do. And I'm good with that. Yeah. I like that. I know what I know, and I know what I don't know. And so I learn from them, but the goal is to elevate and impact and do it within the realm of the relationship. And that's how it works.
I love that. I'm excited for you guys, and between the model and the growth and just everything you've got going on, you're not slowing down anytime soon. And just the mission.
That's not where I came from, by the way.
Yeah.
That wasn't my energy. Back in the day in corporate America, I was a bitch on wheels, and it wasn't nice.
Yeah.
But that's, again, I mean, if you're not growing and changing, you're dead.
Yeah. What kind of existence are you living? It's true. So anybody that's listening, Peg, how can they find Great Expectations? And let's say they have a sister that could really use it, or a friend. Where should we guide them?
Go to the website, www.cge-nj.org.
Okay.
And it'll take you through all of the programs, all of the opportunities, and we'd be more than happy to help.
Awesome. Well, thank you so much, Peg, for joining us today and all the hard work that you've built over these years. It's really, it's incredible.
My pleasure.
Awesome.
Thank you for having me.
Thank
Appreciate
you.
it.
Thanks for joining
Okay.
us.
Bye-bye now.
Bye. Thank you for tuning into the Healing Us podcast. Please like and subscribe and follow us on all channels. Have a great day.